Dr. Jeremy McAnulty and also Dr. Bryn Byrne, who's an emergency retrieval specialist. First of all, let's start with the vaccination numbers. I'd just like to thank everybody in New South Wales who's come forward for vaccinations. We've now just passed the 8 million mark of vaccinations here in New South Wales. Yesterday, New South Wales Health, GPs and pharmacists vaccinated 114,536 jabs. So I just want to thank everybody who came forward to facilitate that. And actually, the other good news is that of those numbers, 26,264 were actually in regional areas. So having just been up to the far west and the west, I just particularly want to thank the regional areas and the residents for coming forward and getting vaccinated. That takes us to 77.3% of the entire New South Wales population who've had their first dose of vaccine, and 44.5% who are fully vaccinated. To 8 p.m. last night, we had 1,599 locally acquired cases. The total number of cases in New South Wales since the start of this pandemic is now 42,000 cases. Extremely sadly, to 8 p.m. last night, New South Wales Health has been notified of the passing, the deaths of 8 people who had COVID-19, 6 men and 2 women. 3 of these people were in their 80s, 2 were in their 70s, 1 in their 50s, 1 in their 40s, and 1 in their 30s. Particularly sadly, none of these people were vaccinated. All had underlying health conditions. I extend my deepest sympathy to each and every one of those people's families and their friends. Dr. McAnulty will give more details in regard to each of these people. To date, there have been 170 COVID-19 related deaths in New South Wales since the middle of June. And since the start of the pandemic, that takes us to 226 deaths in New South Wales. To 8 p.m. last night, we had 147,975 tests. And I want to thank everybody who've come forward, and again remind everybody that the only way that we are going to be able to manage through this pandemic is if you have any symptoms at all, or if you're in close contact, please go and get tested. Follow health advice. I'll ask Dr. McAnulty to let us know about particular suburbs of concern. But I just want to point out that as of 12:01 a.m. this morning, certain parts of regional New South Wales were taken out of the statewide lockdown, stay-at-home. So only certain parts of regional New South Wales are still considered stay-at-home areas. And I think for the want of clarity, I should just read those out. So the lockdown or the stay-at-home areas include Bathurst Regional, Bega Valley, Blaney, Bogan, Burke, Brewarrina, the City of Broken Hill, Cabonne, the Central Coast, Central Darling, the City of Cessnock, Dubbo Regional, Dungog, Eurobodalla, Forbes, Gilgandra, Goulburn Mulwaree, Kiama, the City of Lake Macquarie, the City of Lithgow, the City of Maitland, Midwestern Regional, Muswellbrook, Narrabri, Narromine, the City of Newcastle, the City of Orange, Parkes, Port Stephens, the Queanbeyan Palorang Regional, the City of Shellharbour, the City of Shoalhaven, Singleton, Snowy Monaro Regional, and the Upper Hunter Shire, Walgett and Wingecarribee. I think at this point I'll ask Dr. McAnulty to give us further detail, and then I'll ask Dr. Burns. Dr. Burns is here to talk about the work that the aero retrieval part of our health service does, and will give us some insights into the way people can be looked after no matter where they are across our state. Dr. McAnulty.
Thanks, Minister, and good morning, everyone. I'd just like to talk about some of the figures not mentioned by the Minister. In terms of hospitalisations, we now have 1,164 people admitted to hospital with COVID. This includes 221 people in intensive care and 94 of those requiring ventilation. Sadly, we've had to report 8 deaths of people with COVID in the last 24 hours. I'll just go through those deaths. A man in his 70s from Western Sydney who died at Blacktown Hospital. A man in his 30s from Western Sydney who died at home and was tested positive after his death. A man in his 40s from southwestern Sydney who died at home and tested positive after he died. A man in his 70s from Western Sydney who died at Royal North Shore Hospital. He had underlying health conditions. A woman in her 80s from Sydney's southern suburbs who died at Sutherland Hospital. A man in his 80s from southwestern Sydney who died at Liverpool Hospital. A woman in her 80s from southwestern Sydney who died at Campbelltown Hospital. And a man in his 50s from Western Sydney who died at Royal North Shore Hospital. As mentioned, none of these people were vaccinated. We extend our sincere and deepest sympathies for the loved ones of these people who died. There have now been 170 COVID-related deaths in New South Wales since the 16th of June and 226 in total since the start of the pandemic. We've had a number of sewage detections as part of our ongoing surveillance program to detect evidence of COVID or fragment of the virus that causes COVID. These have included in Byron Bay and Bangalore, in Jindabyne, Harden, Maruya and Yass in southern New South Wales, in Port Macquarie on the mid-north coast, Trangi in western New South Wales and Young in Murrumbidgee LHD. We've not identified recent cases in these locations, so again urging anyone in these locations to be particularly aware of symptoms of COVID and come forward for testing even the slightest of symptoms right away. The suburbs in Sydney with the highest numbers of cases continue to be in western and southwestern Sydney, particularly the suburbs of Auburn, Greenacre, Merrylands, Liverpool, Punchbowl, Granville, Bankstown and Guildford. Just highlighting western New South Wales, cases continue to occur in western New South Wales and the far west. Across western New South Wales Local Health District, there have been 16 new cases of COVID reported to 8 o'clock last night, bringing the total number to 952. In the far west, there's been 13 cases reported yesterday, including 10 in Broken Hill and 3 in Wilcannia. The total cases in Far West so far has been 149, including 116 in Wilcannia and 32 in Broken Hill and 1 in Barwon North. Thanks very much.
Thanks, Minister Hazzard, and good morning, everybody. I am a retrieval specialist with the Air Medical Operations part of New South Wales Ambulance, and I'll just give you a bit of background about who we are. So we are critical care doctors and paramedics working on road ambulances and helicopters, and we also operate doctor flight nurse teams on fixed-wing aircraft. So with respect to COVID-19, our primary role so far in the COVID-19 response has been to assist in the even distribution of critically ill patients across our hospital networks. We do this by moving these patients who are critically unwell in an ED or an ICU, and we move them to another hospital ICU. This helps offload the pressure on these hospitals with high numbers of critically ill patients. This activity has increased over the last 3 weeks, and during that time, retrieval teams have transferred around 90 COVID-positive critically ill patients on ventilators between hospitals. We are increasing our capacity to respond by road and by air to regional and rural New South Wales in our COVID-19 response. So, no matter where or when someone becomes critically ill across our state, the system is and will be ready to retrieve those patients to the intensive care unit that they need. We are also assisting in maintaining regional intensive care bed capacity. The most common theme with these patients, as you've all heard many times at these press conferences and today, is a non-vaccinated status, and it's awful to see these patients in this condition. Often the people we are retrieving are young, they're previously healthy, and one that stands out to me was a young woman I recently transferred who had just delivered a baby. At the Air Medical Control Centre, we have increased our medical specialist cover to assist in providing advice to doctors and to nurses in remote and rural communities 24 hours a day. All of these structures are in place while maintaining our ability to respond to COVID-related, non-COVID-related taskings as well. Lastly, can I just say how proud I am to work with a group of doctors, paramedics, nurses and aircrew who perform these roles in quite challenging circumstances. I view our role as not only a responsibility, but it's also a privilege to manage these critically unwell patients. I also have a very strong view that each member of the public also has a strong responsibility, and that is to get vaccinated and to do it now. Thank you.
Minister, it's a beautiful day today. Are you concerned about people flocking to the beaches and parks?
No, I'm concerned about people that are not vaccinated. I think that the fresh air is actually, we know it is the safest place to be at the present time. Dr. Chant and Dr. McAnulty, and I've talked about that many times. So, but I would say to people who are out and about to maintain your social distance and to just be careful, because while we have many more to get to the required number of people who are vaccinated, we do have risks.
Well, there's a bit of complacency, I suppose, though. If people aren't allowed to gather in groups of 5 until Monday, do you think people will get together at the beach and potentially be gathering in groups of 20, 30, and if they do, will they be fined?
If people are not complying with the health rules, look, no one likes to have these health rules. I, as Health Minister, I'm saddened, to be honest, that I have to sign off on health rules, but we're in a one-and-one-year pandemic. So I just ask people to be doing what they have done along the way. And generally people have been really, really good. I think that I know the media will have photos today of people out and about. They tend to do that. But I think generally that's a very safe place to be.
Former Prime Minister Tony Abbott has actually been fined for not wearing a mask. He spoke to us this morning and said that he thinks it's not part of the Australian character to dob people in. Do you think it's part of the Australian character to dob people in for breaching public health orders?
Oh, look, I'm not going to talk about individual cases. I've avoided that at any stage. What I would say is it doesn't matter who you are, whatever station you have in life, there are orders done. Nobody likes having to do these orders, but it's to keep everybody safe. And so I just say that I hope that people will comply with the orders.
Is there an issue with Pfizer supply at the moment, and are there concerns about getting those vaccines to those younger cohorts, especially ahead of school returning?
Look, I've said this many, many times. Obviously, it would have been wonderful if there had been more Pfizer supplies that were available, but I think the federal government have to be given credit. I know it's always opportune to be critical of anybody on anything in this pandemic, but I think they tried, and they tried to get as much vaccines available as possible. It would certainly be beneficial if we could get more Pfizer, but at the end of the day, the whole world wants Pfizer at the moment. They want AstraZeneca, they want Pfizer. We have 2 very, very good vaccines, and another one certainly coming online soon. I would just say to everybody across the state, Dr. Burns said it, we all have an obligation. Go and get vaccinated.
Will those 16, 17-year-olds get the vaccine before?
Sorry?
Will those sort of 16, 17-year-olds get the vaccine before they go back to school on the 25th of October?
Yeah, look, the intention is to try and get vaccines in arms as quickly as possible, but let's just see, it's still some weeks away. Lizzie?
Minister, there's a number of people who are dying at home, not knowing they've got COVID. What's the problem there? Is there still shame with testing positive? Is there pressure to still go to work? What's going on there?
Look, there have been a number of people die at home who have never even come to the attention of New South Wales Health, or in some cases not even to a GP. And certainly in parts of Sydney, particularly in the southwest and west, I think there's a lot of pressure. This is a disease that's highlighting some of the, or it's a virus that's highlighting some of the inequities in our community. And in some households, it can be a very large household where only one or two people are working. And I think there is a reluctance in many instances for people to want to actually tell us that they're actually not well because they want to go on earning income. I just say to those people that the federal government and the state government have put up economic packages. There's also lots of other support for you. And the most important thing is to stay alive. So please don't hesitate to contact our health system for support. I know, again, I was just up in Wilcannia and Brewarrina and Burke and some of those areas, and what I was seeing there, and Dubbo, what I was seeing there was enormous support, even in the most remote parts of our state, for the communities who are having positive cases. Community members who've come together to provide food parcels and packages. That all is available in Sydney as well. Please, 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 don't run the risk of dying. Seek medical help.
How prevalent?
Sorry, Chris, I'll just do this and I'll come back to you. Sure.
You're talking there about people that are kind of getting into the system too late and you know, declining and dying. Are there also people in the hospital at home system that are already in at home and that are dying? And does the government need to kind of reassess its threshold for when those people are brought into actual hospital because of how quickly they're declining?
Look, there's no hesitation in bringing people into hospital who need to come into hospital. I think the issue is, as we've said right from the word go, and has been said worldwide, that this virus, contrary to what some people say, is an extremely dangerous virus. We have seen people who in the morning are quite well while they're in hospital and deteriorate very quickly and be on a ventilator or in the ICU. So I guess what I would say to people who are at home is don't hesitate. If you're feeling like, a lot of people want to stay at home, that's the other thing, you shouldn't misunderstand that. A lot of people do not want to go into hospital, they want to stay home. And so those people just need to know that we have a world-class health system there for you. If you are deteriorating, if you're feeling like your breathing's getting worse, please contact the health system and make sure you come into hospital.
Are you comfortable with the level of care people are receiving at home? I've got the necessary equipment and everything available, blood.
Each of the local health districts are doing an incredible job. Lots of staff managing those issues. We have obviously people who, there's a transition as well. You can be at home, or in some situations you can also go into one of our health hotels. I think we have nearly about 900 people at the moment being managed in special health accommodation. So there are a range of options. But quite often what we're hearing is that people don't want to leave their family. In earlier parts of the viral outbreak, this particular round, we had larger families often going into the health hotels, special health accommodation. But what we're now finding is that they tend to be individuals. So people are becoming more aware of the situation, but there are still people who, for whatever reason, want to stay at home. I'm quite confident that our health system is by far probably the best in the world. And people are being managed as appropriately as possible, but there will be, in a pandemic, 100-year pandemic, there will be issues from time to time where, for a variety of reasons, including the fact that people just don't tell us, that, yes, they can sadly pass away. Sorry, Chris. Sorry,
just a couple of questions on workplaces, particularly ahead of Freedom Day. Do we know how prevalent still is the transmission of the illness at workplaces, and how that then underlines the importance of maintaining precautions? And when we reach Freedom Day, will those businesses be contacted by health still if a COVID positive person walks in?
Look, all those issues are made on the basis of the epidemiological situation at the time. It may be, of course, that there is no risk to the rest of the public. And right now, I think sometimes the media have thought that that health has always called out every particular location. But if there's not a reason to make that call, to name a business, I mean, they don't do it. And we can remember some cases, earlier on last year where cafes and restaurants just had a lot of people that were exposed, and that's a risk factor. But if there were not a lot of other people exposed, perhaps no other people exposed, then health would make that decision. It's a clinical decision as to who should actually be what particular facility should be called out.
How generally is transmission at workplaces tracking? Do we have any information or knowledge about that?
Look, the issue is that there are still places where it's occurring. The two major places are workplaces and homes. But homes are probably, I think, the major area of our concern in southwest and western Sydney. Sorry. Sorry, could I say, I got distracted by the journalist's phone, but in southwest and western Sydney and in other parts of the state as well, it is the families who often are the ones who somebody introduces it to the household, and once it's in there, it's very hard to stop it circulating. But what I would say is I constantly hear that the person in a household or people in the household who don't get it are those who are vaccinated. So again, the message to the broader community is please go and get vaccinated. You're doing it for yourself and for your family, for the broader community. Sorry. Yeah.
Minister, there's at least 3,500 people receiving at-home care at the moment, and that's up from 1,000 last week. Are you concerned, given you said how quickly a person's condition can deteriorate, that number keeps rising?
We're in a pandemic. It's been planned for and we've expected it, and I think not only me but each of the doctors who appeared before these press conferences now for a number of weeks have been talking about the increasing numbers. We've had, I don't think you were here, but we've had a number of intensive care specialists appear at these press conferences. One of them, Dr. Nepean Nguyen, I remember her saying that they had worked as clinicians for nearly 20 months on what was necessary. So there's been a lot of work done by the clinicians, by the doctors, the nurses, the Dr. Bryn Burns of the world, and it's anticipated there will be an increase. So it's obviously a reason to be concerned in the sense that we would much rather have less numbers, but we also know that until we get the vaccine in arms to the numbers that we've identified, we're going to continue to see the rise. But hopefully we're going to, on the basis of the forward modelling, we'll soon be seeing that rise, or that reach the top of that. But even that can't be certain. It really depends on people going out and getting vaccinated. And as Dr. Burns just said, every one of us have an obligation to go and get vaccinated, not just for yourself, but for your community, for your family, for your nation. I know I'm a little concerned that some people are obviously thinking, well, this doesn't matter, I don't have to do it, somebody else can do it to keep me safe. It's actually an obligation on all of us. Keep everybody safe by going and getting vaccinated. So.
She's pretty nervous about the resumption of large crowds, sporting events and the like, which your government's doing it at 70%. She said that she'd be going a bit more slowly on that front. Did you consult the Doherty Institute on
Sorry, I just missed that last bit.
Did you consult the Doherty Institute as part of your roadmap out? What do you make of her comments?
I think that each of the epidemiologists, particularly in our major research institutes, are the people we should be listening to. But I can tell you that every day, Dr. Chant, for example, is usually in this building at about 7 or 7:30 in the morning. She's usually here till about 8, 9, 10 o'clock at night. And during those hours, she is constantly talking to the AHPPC, which is the group of infectious diseases specialists, epidemiologists, usually a 2 to 3 hour meeting every day. And on top of that, she's talking to the various institutes. So what we're doing is making decisions based on the advice that is coming from a range of sources. Are we concerned? Certainly as Health Minister, I'm concerned to get people vaccinated. I want people to get vaccinated. I want no reluctance. Please, just go out and get vaccinated so we can get back to the way we would all like to be. And I think, although we're talking about very limited freedoms at 70%, we're really aiming for much higher. And as Dr. Chant has said many times, we'd rather be up to 85 or 90%. So I'll come back to you. Let everybody else have a go, then I'll come back to you. Is that all right?
The regional areas that are coming out of
the state.
How quickly can they be returned?
Pardon?
And how quickly can they be returned, and how closely is that being monitored? Very
closely monitored. Every day, quite apart from these press conferences, every day, Dr. McAnulty, Dr. Chant, Dr. Selvey and the other major epidemiologists are talking to all of our regional areas. And we're keeping that up to date every single day, and the information comes to us as to what's happening. In terms of returning to a stay-at-home arrangement in the regions, it literally could be done in a few hours if absolutely necessary, and it has been in the past. I well recollect late nights and late afternoons when a situation has occurred and the decision is taken that we have to do a stay-at-home or lockdown order for a regional area, and moving very, very quickly in the space of 2 or 3 hours. So it can be done quickly if necessary. I'm hoping we don't have to do that, and certainly it's not the aim. Sorry. Yeah, busy.
Before we get to Freedom Day, is there any scope to revisit the capacity rules for the beauty industry to bring them in line with the restaurants with the 4 square metre or gyms with 20 people? A lot of these businesses have private rooms with doors with a lot of separation and feel that they've kind of been let down by these new rules.
I have to say I have more than passing sympathy with that situation. I mean, it's the rules or the requirements that have been put in place at the moment are broad scale to try and apply across the board and give people a sense of where we're going. So the limit of 5, for example, in a hairdressers or ladies' hairdressers, some of them are very large premises. And it may well be that we can, as we move forward and get more people vaccinated, actually make that a much more flexible arrangement. I know from time to time I've had calls from men and women saying to me that they would like, in fact I'd like to have a haircut, that would be good, but I understand ladies would like to have that more frequently, and it's a bit more complex. So all I can say to you is I'm very sympathetic to that. I'd like to be able to convince our Chief Health Officer and other senior epidemiologists that that's where we can get to. But I think the responsibility for all of us is to say, go and get vaccinated, try and get the numbers up, and give our epidemiologists, give the Dr. Chance of the world the confidence to know that she is keeping people safe, even when they're having a hair colour and cut or whatever it may be. Can I just say on that, I mean, I'm not going to name it, but I do recollect in the eastern suburbs there was a particular hairdressers that is very well known. And look, no reflection on the hairdressers because they were doing their best, but a lot of cases came out of that, a lot of cases. So we do need to actually be conscious of that, but also we need to get back to normality as quickly as we can.
Minister, on getting back to normality...
Can I just say I've had to go doing my hair a few times, Lizzie, and it's a disaster.
That's all right.
Thank you. I've discovered the benefit of product, but prior to that it didn't have to exist. So I'm desperate as well, but I understand that others are as well. Yes?
In getting back to normality, that Freedom Day, that 70%, is obviously still quite a few weeks away. We've got picnics being allowed from next week for vaccinated people. Is there
From Monday, I think,
yeah. Is there any scope to perhaps expand any more freedoms to vaccinated people in the meantime to give them more incentives and rewards for getting vaccinated early, like perhaps expanding it to 10 people who can gather outside or something?
Yeah, what I would say is that every day we meet and try and discuss these issues as a group here in the health team. Me, the various ministers, we're all working extraordinary hours as well, and sometimes trying to find that time, which is a bit why we're also looking at trying to limit some of these press conferences so that we can actually spend the time. As the numbers rise, we need to be focusing on those sorts of issues. But I share that concern. I think we need to be looking at, as the numbers go up, what other freedoms we can, what other normality we can bring back into our lives. So yeah, I'm totally supportive of that, and if I can just get some time to myself to do it and work with the team, I'll be doing it.
Well, on that basis, can we bring forward...
You cancel the 11 o'clock press conference that's been run by...
They're not cancelled. That's not the case.
For neither yourself or the Premier fronting...
Actually, I'm here right now.
From Monday, has been described by one of the mayors of the 12 LGAs as an insult to the community, especially given that
I think I know who that mayor would be. Look, can I say the one thing that shouldn't come into this at any stage is the political game playing, and I'm not interested in that. And mayors can have their views, but that particular person...
Parliament's not sitting, and, you know, people want answers, and they tune in at 11 o'clock every day to listen to you and the Premier giving those answers.
All right, let me just explain this. What I just said about trying to get some clear air for the team to be able to think about the things that you're raising and that you're raising. If we do, say, 4 people or 3 people at one of these press conferences, you think it's just for 1 hour or for whatever it is that you walk in here. But in fact, there's the preparation for the morning. Dr. Who's over here, Dr. McAnulty is here very early getting ready. So is Dr. Chant and the others. There's a massive team of people getting ready and drawing in all the information. We then are in here for probably 3 or 4 hours beforehand. I'm certainly here by usually about 8 or 9. That time is taken out from the time that we can do the sorts of things you want us to do, which is think clearly about how we move forward. So if there's, say, 4 of us, let's say average 2.5 hours, that's, 10 hours a day. That's about 70 hours a week, and I think that's actually a very light-on situation. I think getting the balance right, making sure we get the information out to the community is critical. But we were doing that before. Dr. McAnulty and the others were doing videos as we go. And I'm quite sure in the present time, while we're dealing with all these issues, we will still have press conferences. All that was being said was they might not be absolutely every day. So have no fear, we'll be here. Yeah. And I also think that if it's the 70 hours is probably more like a couple of 100 hours a week taken out by the most senior people in our health team to focus on these issues, when in fact I'd like them to be focusing on how do we actually move forward with the sorts of going back to more normal issues. So how can we get to a lot more normality back in our lives? Sorry,
it sends a message to the community that this is serious, and so people are going to stop engaging.
No, that hasn't occurred in any other jurisdiction. I think I was just talking to Dr. Burns before about a similar issue, and we couldn't think of any jurisdiction in the world where this occurs. Our jurisdiction has been the one that has done it, and we will continue to do it as need be. So let's not harp on that one. Yeah, Lizzie.
Christina Mary is campaigning in the Fairfield LGA today. Does she need a permit to do that, and has she got one? Do you know?
Well, first of all, I don't know whether Ms Keneally is campaigning, so I'd rather not comment specifically on her. And 2, I don't know. Generally, politicians, I think there are some exceptions that are available under the rules, obviously, for essential work. But I'll have to come back to you on the detail of that. I'll have to get the legal advice.
Just on regions being put back into lockdown or mobility contained after a surge in cases once we go past those vaccine thresholds. Do you have a threshold? Do you have a number of how many cases there will be? Can you
Look, that's been asked, I'm sorry to say this, but it's been asked probably every press conference we've had, and the answer is those issues are being looked at on a day-to-day basis. It depends on a combination of factors, not least of which is the total number of people who are vaccinated and the total number of people who are becoming positive, and what are our capacities in a whole range of areas. So I think it's fair to say that the research institutes bring all their power to those sorts of issues. We work with those research institutes, and it's better to let us work through those issues with the research institutes.
In the instance after Freedom Day where a COVID positive person has been at a business, will those close contacts of that person still be required to 14-day quarantine?
That's all being looked at the moment. I mean, obviously, as we increase the vaccination rates, there's going to be less pressure in a sense. One of the dangers, and again it goes to the issue of getting time to think about these issues, one of the issues that we are reflecting on at the moment is what parts of what we put in place here in New South Wales earlier in the pandemic are no longer appropriate for this stage of the pandemic as we get more people vaccinated. And if we can just get the time to do that and sit down with all the teams, I think we'll find that we are able to move forward with a lot more nuanced approaches.
And has any consideration been given to the possibility of this whole return to school being brought forward, given our quite successful vaccination take?
I've got to say, Chris, as an ex-school teacher, I would love to have the kids back at school earlier. But I think the point that the Premier has made in answer to similar questions, I don't think you were here when they were asked, but is that teachers, the education system, it's a very big system, and to be able to give certainty is probably the priority there. So that's why it's been set as that particular date. So I don't believe that would be moved forward. But the one thing I've learned in a pandemic is never say never, because if suddenly everybody rushed out and got AstraZeneca and vaccinated and we got the numbers up, well, and if we got the time to look at the issues, hopefully we'd be able to make some changes. But I don't believe that will happen in relation to the schools at this stage.
Just on people out and about enjoying the warm weather, would you expect to see an increased police presence in some of those major beaches, Bronte, Bondi, to make sure people are doing the right thing?
Look, can I say again, the police obviously have a role, which is to ensure that the health orders are complied with, as was referred to in this press conference, but no matter who. But I also think that the police have done an amazing job, and I want to thank the police. It's been a very tough 20 months, and they've often had to make decisions on the ground about just being rather more supportive than necessarily punitive. And I think they've done that from what I've seen many, many times. And again, having just come back from the northwest and western part, the furthest parts of our state, everywhere I went, I heard positive comments about police who are out on the ground, often delivering food hampers, working with the community. I think that has been equally applicable in southwest and western Sydney and across Sydney more broadly, across our state generally. But they are also there to do a job, and if somebody is being deliberately obstructive in regard to the orders that are in place to keep us all safe, well, of course, they can issue the fines. Hopefully they don't need to do that. Sorry, I'm sorry, you haven't asked a question yet.
With the lockdown still ongoing and the cases expected to surge, not going to be having the daily press conferences, the information we post online, people understandably be a little bit nervous about that. How will they be able to get their questions answered? Are you convinced that they'll be able to get enough information?
Well, I was just saying to you, I said to you earlier that there will still be regular press conferences. There will be. It's just they might not be 7 days a week, which would allow us a little bit of time, and all the other experts here. I mean, we're getting up into higher numbers, and we need to have the time to be able to bring our focus with clear minds as to what we need to do. And that applies to all the people who work in this building and us to be able to do what we need to do. So I think that it is vital, but equally balance that against, of course, we're going to make sure that all the information gets out to our community. I don't think anybody could suggest that that I or the Premier or any of the other ministers haven't been available. I think this is probably about 500 and something press conference I've done in the last 20 months, and it would be similar for the Premier. So I think we will continue to do what we need to do to make sure the information gets out. But I think what was being said was that if there's nothing particularly new on that particular day, except the numbers, then we could resort to, or go back to being what Dr. McAnulty and his team did so well before, which is to give all the data, the necessary data. But if there are issues, of course we'll be here. That's not a non-issue.
So can you confirm that churches will have to turn away unvaccinated worshippers once they reopen? And have you been lobbied by any archbishops about that?
I haven't... I get lobbied by everybody. And I've certainly had lots of conversations with faith leaders on a whole range of issues. But I need to actually look at where we're at by the time we get there as to whether that's going to be a requirement that they be turned away. I don't think that is currently part of the arrangements, but I'll have a chat to is it Anthony Fisher or whoever may be asking that question. Anthony texts me regularly or calls me, so I'm sure I'll have a talk to the Archbishop about that. Yep.
Community sport won't be returning when we hit 70%. Why is that? And is there a vaccination target for community sport?
Look, I really want to see it. I think we all want to see community sport back as soon as possible. And again, Dr. Chan's team, the public health team and the broader health team have been concerned about people coming together. I mean, often I did it for many years, stood on the sideline with all the other parents, usually in close proximity, and tried to make sure that we could support our children. I think the desire to have one rule applicable across the broader state has been a bit of a challenge. I know I've heard some of the political local government people talking about a two-tier city or whatever the expressions they use. That's actually just being a bit silly, a bit political. The reality is, though, it does actually mean that we have to be very careful in sending messages that whatever we're doing is fair to everybody, to try and avoid the political attacks. But, well, and what I was going to say there, Lizzie, was that I think Dr. Chand and the team, again, are very aware that trying to get people out to play sport is very high on the agenda. I think give us another few weeks and see how we go with the vaccinations, and I'm fairly confident that we'll be able to move in that area, but we still need to just get those vaccination rates up.
On the issue of sport, Minister, is the government or health department any closer to an agreement with the football authorities on the World Cup game? that they'd like to play in Sydney next month?
I haven't been involved in those discussions, so we'll have to wait till next week to find that out. I think probably the Deputy Premier or Minister Ayres would have been involved in those discussions, but I haven't been. All right.
A couple of questions for Dr. McAnulty.
Sure.
All right. Currently there's a health response underway at an apartment building in Kingswood after 4 residents tested positive. How many people are in that building? It's understood that they do mix quite freely and amongst apartments. And what information do you have with regards to that?
Let me just provide what information I have. Yes, there are a number of there's restrictions placed on an apartment in the Kingswood to help reduce the spread of COVID in that building. It's a close-knit community of residents who have been moving freely among apartments, and there's been concern of transmission within that building. So it's now subject to public health order, where there are tighter restrictions that limit the access and movements of the residents. So we've got the intense across-government public health response to make sure people are supported with welfare, make sure that we're understanding the epidemiology of the outbreak, and so that people are being tested and then self-isolating for the period they need to.
How many people do we know are infected or are potentially infected?
I understand there's 5 people across at least 3 apartments, so it looks like there's been transmission within that area. So, and we know that apartments can be a high risk for transmission depending on how they're set up and depending on how much movement there is between people who, may think that it's okay to visit a neighbour or something, but we've got to be very careful in these situations because apartment outbreaks can amplify an outbreak in a community.
And are there concerns about housing commission in the inner city suburbs, Waterloo, Redfern, where we have seen some case numbers increase? Apparently there was a case in a housing commission block. Do you have any information on that, and what are the issues surrounding that?
I don't have information on that specific one, but we have had over the course of the last several weeks a number of cases and small outbreaks in housing apartments, both apartments and other situations where people are sharing facilities, lift wells, visiting each other's apartments. So these are very concerning areas that we've put a lot of resources in and work across government with police and welfare and security and Department of Justice and so on to make sure that people are supported and able to isolate. So nobody wants to see an escalation of cases in a whole block of apartments, and so we've got procedures in place working across government to try and minimise that risk.
Doctor, in the inner city suburbs of Redfern and Waterloo, we're seeing comparatively fairly low vaccination rates compared to other Sydney suburbs, but they do have those high density apartment blocks. So what is New South Wales Health doing to target these areas and make sure we get the vaccination rates high and the cases low?
Yeah, so vaccination is the key to controlling this outbreak, this epidemic, and the local health district at Sydney LHD has been working very closely with the community to provide vaccination, and they've had specific venues opened with community leaders to promote vaccination and to provide vaccination and choices to those community members. So it's just important to remember that no matter what age we are, please come forward for vaccination. There are so many hubs, there are so many GPs or pharmacies that you can go to. There shouldn't be a barrier to getting a vaccination at this point.
Last question,
Just give us an idea of how much the workload of you and your colleagues has increased over the last month or so, and what it's kind of doing for the morale within the group?
Well, morale is pretty good actually, because we feel we are part of this whole health response to this pandemic. So I spoke to one of my colleagues who's out in Wilcannia today. He's been out there for 4 or 5 days, and the health response out there is working very well. So morale is fine actually. In terms of the overall workload, yes, the workload is increasing, but we are matching that with additional resources. So we've put additional resources in place to meet that workload. And interestingly, on the flip side of all of this, the other major trauma, car accidents, sporting-related accidents, has decreased. So one of the few benefits of the pandemic is that those major accidents and traumas do decrease. And I would hope to see after the pandemic that people revert to a sensible kind of process like we're seeing now.
You're urging the people to get vaccinated in that message. Are you saying to people out there that yes, you can get more resources in, but is there a point that you'll potentially reach where you will be under pressure, you will be stretched? Is that what you're telling the community?
No, we are able to meet the demand, and we are various phases of response, and we're in the early phases of grading that response up. So we have capacity at the moment. And yes, sure, every country in a pandemic will go through pressures on the systems. When this pandemic started, I was talking to colleagues in the UK, Italy, France, and it was far worse than we're seeing here, I can tell you, far worse. So we are within our means. We are trying to get people vaccinated. But for New South Wales as a whole state, we're able to provide a response, no matter how far those people are away from, intensive care or critical care.
Can I just say, sorry, can I just say I want to thank Dr. Burns, but all the team. I mean, when I stand next to these guys, I feel like I'm standing next to giants. They are people who are keeping us safe amazingly across the state. He won't tell you, but he actually jumps out of helicopters as well, out of what they call Augusta AW139s, I think it is. The massive helicopters that can get almost all across our state in the space of a couple of hours. They're fast, they're big, and they come with people like Dr. Burns and paramedics and on occasions nurses as well. So I just want to say thank you. I think to the whole community, we are lucky. I should have taken that off, I'm sorry. To our whole community, we are lucky to have the Dr. Burns of the world and his colleague, who I actually met this week at Wilcannia. She comes from, I think, St George, was it? Yeah, St George Hospital. And she's out there in the farthest parts of the state keeping the community safe. So I think what I would say is if you see a nurse, a doctor, a paramedic, say thank you. Say thank you to them because they're the ones who are keeping us safe. And obviously the cleaners, even in our hospitals, the administrative staff, say thank you. And I know that they have told me they value when someone drops a meal in, a neighbour drops a meal into them because they're working flat out, or a box of chocolates. Just say thank you to these giants of our pandemic. They're keeping us safe. I also want to thank the Auslan people who've been with us now for 20 months. Again, thank you to all of you for making sure that people who are challenged in their hearing can actually get the messages. And again, thank you to all of you this morning for getting the message out to the community to get vaccinated, and thank you for your courtesy this morning. Thank you.